are about to listen to the Dr. Dahlia Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Dahlia Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Dahlia.
All right, welcome back to the Dr. Dahlia Show, 1-877-DOC-DALI, 1-877-DOC-DALI. So, unfortunately, an area where I would ski a lot in my younger days is now the site of a search and rescue mission, as 9 people are still missing after skiing in the mountains around Lake Tahoe. And when an avalanche hit, 6 people have survived. They are being treated for their injuries. But I just want to kind of review avalanche safety for those of you who get really, really excited about hitting the fresh powder, as most of us want to do as soon as there's some fresh snow. And boy, did the Sierra Nevadas get some amazing snow the last couple days. In fact, Las Vegas got sprinkled with some snow yesterday, too, as we have the storm coming in. Unfortunately, it could trigger avalanches, especially if there's humans, tipping the scale of the delicate balance of the snow and the vegetation on a mountain. And so what happened I believe yesterday, was a group of 15 backcountry skiers led by Blackbird Mountain Guides. According to Daily Mail, we're on Castle Peak. It's about 40 miles from Mount Rose. This was late Tuesday morning. They were hit by an avalanche when a huge storm dumped heavy snow. They became Castle Peak is about a 9,000 foot mountain north of Donner Summit. There's Donner Pass and Donner Summit. And for those of you not really familiar, like Donner, you mean the Donner Party? Yeah, the summit got its name from, the group of pioneers who got trapped and they resorted to cannibalism. This was in like the mid 1800s. And so there's Donner Pass and then there's Donner Summit. And so Castle Peak, you boast some beautiful views and skiing, but unfortunately, it could be pretty dangerous. 6 of the skiers survived because they made this tarp, this makeshift shelter. They had a tarp. They were still trapped, so rescuers got them, sent them to nearby hospitals, but we're still missing 9. And, being that here we are the next day, it's been over 24 hours, that's pretty frightening. The National Weather Service has issued a winter storm warning for much of the northern and central Sierra Nevada. More snow is coming, more winds with gusts up to 55 miles per hour. Apparently, about a month ago, there was a snowboarder who was killed near the Sierra Nevada area. Hikers died near Mount Baldy 2 months prior. It could be pretty treacherous. And so, when I went to ski, I would be in the middle of class and I would always have my ski stuff in my truck. On Fridays, if we got to leave early and I had a half-day pass because I took a ski class, and when you take the ski class, they gave you ahead of time your half-day passes. When the teacher would be up there in his bib going, hey, guys, let's go hit the slopes. I mean, we would run and go. Did I have a shovel? Did I have an airbag? I don't think they had airbags back then, and now they do. So these airbags help you. So when an avalanche happens, it's the unsettling, delicate, vulnerable snowpack that causes an avalanche or this snowfall effect. And whenever there's a recent storm, that's not obviously a stable environment. Now, we don't like ice. We don't like packed snow. We want powder. So we try to hit the slopes right after a storm. But unfortunately, that's where it's more risky for avalanches. And then when it happens, sometimes you can hear a little bit of a sound. Sometimes if you feel a massive change of wind or temperature, I was always taught, look up. Make sure you don't start seeing changes because there's only milliseconds for you to get out of the way. What do you do if you recognize an avalanche? Get to the side. Either go diagonal or just like with the riptide, get to the side. All right. The side is slower than the center part. So you want to fall slower. Also, you should be wearing a helmet. Because with an avalanche, you can hit your head. And if you hit your head, you can't think of survival techniques, and that also lessens your chance of survival. So you should be in a helmet. You should get to the side, either horizontal horizontally, laterally, or even diagonally, because if you're on a slope, you trying to cross country it on the side, just get to the side. And then if you could grab onto a tree, to hold on to a tree, that could help because some of these trees can withstand it. Unfortunately, trees can fall too. But at least if you could if you can't get out of it, you could try to hold on to a tree. If you have one of these airbags, they're very bright. A lot of them are orange, bright colored, and they also help keep you more to the surface because you're more dense than snow is. But if you do get covered, if you do get buried in snow, the first thing you want to do is carve out an air pocket in front of your face. Hopefully you have a tiny shovel on you. A lot of skiers don't think to, have this stuff. Like in scuba diving, we're taught have a knife on you, have equipment on you. Also have when you ski, if you're going to be skiing in terrain that could have an avalanche, have a beacon or one of these detectors that could pick up, satellite detectors that could pick up where your location is. That's very, very helpful. Also, tell people you're going skiing. Tell them where you're going. Tell them what route you're going to do. If you change that, try and text or do something. Usually now we can on the mountain still get good texting, good cell service. So anytime there's a change of plan, tell them where you're going, what you're doing, even send pictures. All right. And tell your family, I'm not sending selfies. It's just, you need to know where I am. And then when you are buried, God forbid, if you are buried, you want to dig yourself as much of an air hole as you can. Your spit is warm. Your spit is 98.6 roughly. I know we're kind of changing that because a lot of our core temperatures are maybe a little off of that. But still, you have 98 degrees spit. All right. You don't want to lose your fluids, but, you are surrounded by ice if you need to suck on the ice. Downfall is going to be yellow snow. But you could do that. Your pee is warm, and your pee can melt some of the snow. The only problem with peeing is if you do end up needing to drink the snow, you don't want the yellow snow. But you have a lot of your body that could warm that, that ice up. And then hand up, try to have colors, things like that. Hopefully rescuers can find you. Godspeed. I hope they find these skiers. 1-877-DOC-DOLLY. Don't go away.
Have you ever thought you'd like to buy and sell houses but didn't know how or where to get the money? My name is Ron LeGrand, and over the past 40 years, I've bought over 3,000 houses without using my money or credit and taught thousands to do the same. Today, even in a virtual environment, we buy nice houses in nice neighborhoods using no banks, realtors, contractors, or other costly entanglements, and build huge cash flow and wealth without the hassle of tenants, all without credit and little or no money. You don't need a license or experience, and I'll show you exactly how it's done. Text FREE to 99799, and I'll send you my free training. I promise you I'll change the way you think about real estate and open the door to a new lifestyle that doesn't involve risk or rehabs and can quickly replace your current income. Text FREE to 99799, and let me show you how to take your life back and build cash flow and wealth from your home. That's FREE to 99799. Again, FREE to 99799.
Hi, it's Mark Falter, host of the Financial Fitness Show. I strongly believe that no one should ever pay 1 penny more in taxes than they are legally obligated. Unfortunately, for most hardworking Americans, this just isn't the case. Why? Because most people spend more time planning next weekend's getaway than trying to ensure they're going to pay less in taxes. My financial fitness team has put together some materials that I know are going to help you. It's the Tax Savings Kit. Tax Savings Kit includes 3 things: free tax analysis, top 10 ways to pay less in taxes, and an investor's guide to taxes. Now, how do you get it? Simple. 866-764-2635. Again, 866-764-2635. I'm Mark Falter. This is Financial Fitness, making personal finance profitable.
Welcome back to the Dr. Dahlia Show. 1-877-Dr. Dolly, 1-877-DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. So we're being told that the temperature of our bedroom could affect our heart health, and that heat places extra demands on our cardiovascular system. This is according to a study lead author Dr. Fergus O'Connor from Griffith University in Queensland, Australia. Now, we talk a lot about keeping our hearts healthy by cutting smoking and keeping our blood pressure control and diabetes, etc. But as it pertains to our sleeping temperature, that's kind of something we don't usually talk about. We do have a guest that we're going to talk to about heart health as it pertains to fetuses, and then we'll get back to this with adults. I'm really, really excited for our next guest, Dr. Mao Lee Shaw. Dr. Mao Lee Shaw is an attending pediatric cardiac electrophysiologist in the Cardiac Center at Children's Hospital of Philadelphia. And she is going to they're going to speak about cardiac care in fetuses and how we are able to save the lives of these babies, as 1 in 110 babies in the U.S. are born with congenital heart disease. Dr. Mao Lee Shaw, thank you so much for joining us.
Thank you very much for having me.
Wow. So, yes, I mean, the number one birth defect, I believe, is congenital heart disease. Talk to us about how many babies are born each year and why it's so common.
Yeah, so you're absolutely right. It is the most common birth defect. 40,000 babies are born each year in the United States with congenital heart disease, and this number translates to 1.3 million children born every year globally with congenital heart disease. About 25% of these babies have a critical form of congenital heart disease and generally require an intervention during their first year of life.
And finding it early is critical. Talk to us about how we're, able to find it.
Today, most of the congenital heart disease are diagnosed in fetal life, and this diagnosis is made with a fetal echocardiogram. This is an ultrasound that's performed on the fetus at approximately 20 weeks. It's what we call an anatomy ultrasound to evaluate the fetus anatomy. Following birth in the United States, there's a mandatory newborn screening test for clinical congenital heart disease. This is a pulse oximetry test, a very simple test using a finger sensor to measure a baby's oxygen level. There are some forms of congenital heart disease that are not critical, that are detected later in life or can be treated later in life. But critical congenital heart disease requires an intervention in the first year of life.
Do we know why there's so many babies affected?
So we do know that some forms of congenital heart disease are associated with genetic conditions. Some occur due to environmental factors. Some may occur due to medications given in the first trimester of fetal life when the heart is being formed. Some conditions are caused by maternal infections in the first trimester when the fetal heart is being formed, but many forms are what we call sporadic without a single identifiable risk factor, and this is a hot subject for research, and I think we're going to learn a lot more in the near future.
Mm-hmm. Yeah, we recently talked about dextrocardia on this show, as Catherine O'Hara, who had recently passed, had dextrocardia, and the cilia and how that process could happen. It's fascinating. Not everybody with dextrocardia will have cardiac, congenital heart defects, but it's fascinating how sometimes that can be a sign. And so identifying where the heart is important, especially if it's somebody with situs inversus and all their organs are flipped.
Fascinating, yes.
We definitely want to catch that early. So when you do have a child, one of the first things I tell parents is most newborns shouldn't have coughs. we don't usually see a 21-day-old cough. Talk to us about some of the signs, cyanosis, things like that, that can prompt parents to get an exam.
Yeah, excellent point. So babies are especially vulnerable because they're nonverbal. They can't tell us what they're experiencing. So what do parents look for? I think the appearance of their baby is very important. A baby shouldn't look gray or pale. A baby's lips should not be blue. You mentioned cough. I think you're right. A baby should not be coughing in the first month of life. So an unexplained cough might need further evaluation. Now remember, the most activity a baby does is feed. Sometimes the stress of feeding can throw babies who have heart defects into heart failure, and this is manifested as rapid breathing, tiring out while feeding, sweating while feeding, poor weight gain. So any difficulties, obvious difficulties with feeding may be a clue to underlying heart disease. Now, fortunately, older children will be able to verbalize their symptoms. Some of these symptoms include shortness of breath, passing out or fainting, especially during exertion, irregular heartbeats or rapid heartbeats, sweating in the ankles and feet, not being able to keep up with their peers. Some of these may be associated with an underlying heart condition.
Exactly. And I always tell parents, before you consider using telemedicine for an asthma evaluation, make sure that child is examined. I can't tell you how many parents have thought their child had asthma because they were struggling during PE or physical activity, and it wasn't asthma, it was a cardiac issue.
Excellent point. I concur with you completely.
Wow, we're talking to Dr. Mauli Shah, attending a pediatric cardiac electrophysiologist in the Cardiac Center at Children's Hospital of Philly. Electrophysiology, one of my favorite subjects when I studied pediatric cardiology and cardiology. Talk to us about arrhythmias and what treatment options are available for children who have actually dysrhythmias. Yeah.
Yeah, so a cardiac arrhythmia is an irregular heartbeat, either too fast or too slow, which is caused by disruptions in the heart's electrical system. There are many underlying causes. Some causes may be congenital and abnormal electrical pathway formation. Some are inherited, genetic conditions. Some arrhythmias occur because there is damaged heart tissue. Some are triggered by infections of the heart, dehydration, electrolyte imbalances, sometimes stress, stimulants, excessive energy drinks. So there's a variety of conditions that can bring on an arrhythmia. And the treatment really depends on the underlying cause. There are patients who may not require any treatment. All they might need is lifestyle modification and reassurance and continuing evaluation and surveillance. But those with established fast heart rhythms, the future is really bright because we not only have medications to control their heart rhythm, but we actually have minimally invasive procedures that can cure the heart rhythm disorder. And this procedure, one of them is called a catheter ablation. It involves introducing a catheter or a tube through the blood vessels into the heart. We map out the anatomy and the electrical system with three-dimensional mapping and localize the abnormal cells that generate the fast rhythm. And through the catheter, we can deliver hot or cold energy to ablate or destroy these cells. And for majority of the patients, this is a permanent cure. This can actually cure an underlying heart rhythm disorder. There are also novel devices for monitoring heart rhythms and pacemakers for slow heart rhythms and defibrillators, a lot of new technology and devices to help patients lead a very normal life despite having implanted devices.
No, it's amazing what we could do, and we've had specialists from CHOP talk about even, intrafetal surgery that they've been able to do. So, I mean, the advancements is amazing. I know your time is limited. Where can my listeners go for more information?
An excellent website is chop.edu/heart.
Well, we appreciate everything at the Children's Hospital of Philadelphia, especially the Cardiac Center. Dr. Mally Shah, thank you so much for joining us, and we can't wait to have you back.
Thank you so much for having me.
All right, guys, don't go away. We'll be right back. 1-877-DOC-DOLLY.
Looking for a gift that can actually help secure someone's future? It's Mark Falter's new book, Common Sense Income Strategies. It makes the perfect gift for that special someone in your life. Mark has helped thousands of hardworking Americans secure their financial future by using time-tested strategies that continue to create wealth, whether the market is up or down. Strategies that will make perfect sense once you take the time to read this powerful book. Common Sense Income Strategies brings to you what Mark has been teaching in person and talking about on the radio for decades. You've worked too long and too hard not to see the fruits of your labor. To learn how to receive your free copy, call 866-764-2635. That's 866-764-2635. Secure your future with Common Sense Income Strategies by Mark Falter. Again, to learn how to receive your free copy, call 866-764-2635. That's 866-764-2635.
Show. Thank you all for tuning in. 1-877-DOC-DOLLY, 1-877-DOC-DALI. So going back to this study, looking at if your bedroom is hot, that could cause increased workload on your heart. That's a little tricky. Excuse me. I was freezing last night. We had freezing in Las Vegas is when the temperature drops into the 30s. And yeah, that should be cold, for most people, but I mean, it's not like Montana weather. It's not like Minnesota weather or North Dakota weather. And considering the snowstorm that hit a good part of California and Nevada, I mean, we were pretty cold. And yeah, I'm trying to up the heat and we teach everybody to try to keep the room temperature at about 68 degrees because that helps you sleep better. You actually increase your metabolism. And the 68 is a nice sweet spot, but that's still kind of chilly. And you have a lot of individuals, especially older individuals, that are cold. Well, this study coming out of Queensland, Australia, looked at how the higher the temperature, the more work you're putting on your heart. And with more stress on the heart comes cardiovascular risk. So according to study author Dr. Fergus O'Connor, he says when the human body is exposed to heat, its reaction is to work harder to try and circulate blood to the skin surface for cooling. Now, this changes the whole snowbird migration with, a lot of older people leaving their winter homes during the winter to come down to the south, right, where it's warmer. However, many people will just move, not just stay during the winter months. We don't have money for two homes. So people move south, and now they're, in 100-degree weather, humidity. You almost wonder if it's safer for them to stay put. I think like the best places would be San Diego or southern Utah, where the weather is more ambient. Phoenix, Phoenix gets hot. Never mind, Phoenix gets pretty hot. Southern Utah gets pretty hot. Vegas gets pretty hot. San Diego, I think it's nice year round. Kauai, go to Hawaii. I think that's nice. But anyway, Dr. O'Connor says when the heart works harder and for longer, it creates stress and limits our capacity to recover from the previous day's heat exposure. So they wanted to look at real world bedroom temperatures and how it affects older adults. So they followed 47 adults living in Southeast Queensland. They average about 72 years of age. And they said while many sleep observations are conducted in special clinics, this was a free living study, meaning the participants carried on with their normal activities and sleep schedules, but the scientists monitored their participants through an entire Australian summer, from December to March. Each person wore a high-tech fitness tracker to monitor their heart rate from 9 p.m. to 7 a.m. Sensors were then placed directly in patients' bedrooms to record the temperatures, monitoring over 14,000 nighttime hours of sleep in total. The temperature at which the heart began to show signs of disruption, according to Fox News, was when it was over 75 degrees Fahrenheit. If the temperature was between 75 and 79 degrees Fahrenheit, the odds of clinically relevant drop in heart recovery rose by 40%. So for those of us going, let's have a cool 76 degrees, that could be problematic. If your room temperature was between 79 and 82 degrees Fahrenheit, the odds doubled. Above 82 degrees, the risk was nearly triple in terms of heart stress and recovery compared to if your room was cooler. So what do they recommend? Well, Dr. O'Connor says for individuals aged 65 years and older to maintain overnight bedroom temperatures of 75.2 degrees Fahrenheit. For those of you who like Celsius, it's about 24 degrees Celsius. They say that will reduce the likelihood of experience heightened stress responses during sleep. Now, does this mean heat is what's really causing the heart issues? Could it be your, drink of alcohol or wine before? Could it be your sleep apnea? Could it be your weight? Could it be the dogs waking you up every hour like mine did because they didn't like the wind and hearing the patio furniture crash against the house? I think there are a lot of issues. But, looking at this one piece doesn't mean it's the only piece to our heart health when we sleep, but it does show a kind of a association. It doesn't mean direct cause and effect, but it does show that there may be an association. These wearable devices that people wear, I like the fact that people have access to some of their cardiac metrics, but what I don't like is when a patient calls up telemedicine saying, yeah, I have chest pain, I need antibiotics. And I'm like, well, this could be your heart. They go, no, because my Apple Watch said my heart was fine. So maybe I'm starting a pneumonia. Give me antibiotics. And I have to say, look, your Apple Watch on your wrist is picking up some very important metrics. But did you have a 12-lead EKG? Did you have a stress test? Did you have an ultrasound of your heart? Is your Apple Watch doing that? So as long as you understand that your wearable devices have some limitations, I have no problem with you using them because they're an added piece of information and patient education. I think that's great. Now, while we're talking about all this hot and cold, what about your non-sleep? I mean, should seniors be, coming to Phoenix or Miami? I mean, is that unhealthy? Well, remember, we just spoke about over the winter season. I mean, now we're still in the winter season, but we just spoke about how cold stresses the heart and how shoveling snow stresses the heart and how lack of activity. I mean, I love the fact that I could go outside with the dogs practically year round. And I live in Las Vegas, Nevada. I want there to be snow. I want white Christmases. That's why I was so happy to see some snow sprinkled like powdered sugar on the mountains today. But I mean, I have a pretty mild winter. And so it's, I'm pretty fortunate. But I want, to feel like, what the rest of the country feels like sometimes. I feel guilty that, I'm in, hotter weather. But being in cold climates also stresses the heart. If you're not out there exercising, if you're more stuck indoors because it's snowy. In fact, I had a family call up yesterday with telemedicine where they couldn't even get the medication because the streets in Reno weren't plowed yet. The snow hit so fast, so hard that they're kind of stuck. So they can't go and get the medication I'm prescribing. The kid was not in distress. We didn't have to call an ambulance or anything like that, but the medicine had to wait till the next day because the roads weren't plowed. So I think those are things you also have to take into account. You know, it's interesting. I have conversations with my husband all the time. You know, we talk about downsizing. We talk about AI kicking us out of our jobs. He's a chiropractor, so he'll probably have a job longer than I would as a physician. Yeah, believe it or not, AI is going to be kicking a lot of us out of jobs. So we talk about downsizing. He goes, well, if we move to the Midwest, you know, it's less expensive there. And he's not wrong. You know, I love living in Southern Nevada. I've lived here most of my life. I got friends here and family, so I don't want to move. But, you know, I tell him, I go, look, you know, if we are looking at another place to live, we have to, you know, keep a bunch of different things in mind. You know, weather, changes in weather, our ability, you know, as we age to do heavy shoveling of snow, our proximity to medical centers. What if we need a cancer center? What if we need a cardiac center? Where are we? You know, one thing I like about Southern Nevada is if we really, really had to, we could go to LA or we could go down to Mayo Clinic. We have fantastic hospitals in Los Angeles, but if we did need some high specialist type of issues, Joel Stein for eyes, you know, in LA, I train there. You know, I like being at least driving distance from, you know, a medical center. You got Mayo Clinic up in Minnesota. You got Sloan Kettering, and you know, so there's variety of great hospitals, but these are things you got to think about. So, in terms of this study, don't panic. Don't have your temperature super high. Even though I understand sweating is a great workout, you do burn a lot of calories sweating. That might put undue stress on the heart. Look at me teaching you stuff today, huh? Wow. 1-877 Dolly. Don't go away. Dr. Dahlia here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
Hey, America. How tired are you of mainstream corporate media's biased narratives and manipulated news? Their dishonesty and attempts to influence this generation have been exposed, put on display for anyone who's even half paying attention. But the New American Magazine has been an honest source of news and commentary for over 50 years. This is your opportunity to receive the stalwart of principled journalism at a deep discount. Picture a beautifully published magazine arriving at your doorstep twice a month, packed with insightful stories written with integrity. It's also available digitally on the New American's mobile app. Get up to speed with intelligent coverage from a freedom perspective. Right now, for a limited time, the New American is available to radio listeners at a 25% discount on a new subscription. Visit thenewamerican.com/radio25 and receive 25% off. Subscribe today at thenewamerican.com/radio25.
We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877 Dr. Dahlia, 1-877 DOCDALI. So whenever something kind of makes you go, well, we talk about it, just like the Nancy Guthrie case. I hope to God the 84-year-old woman, mom of Savannah Guthrie, is okay, but the case just seems so odd, and I'm not sure why they still haven't found her. And I get abductions are not easy, but a lot of questions, a lot of, it took 3 sweeps of the house to find all the cameras. Just, whenever things just make you go, we do like to talk about it. And some of you have asked me about the GoFundMe for actor James Van Der Beek. James Van Der Beek passed away. I believe he was 41 when he passed, and he had colorectal cancer. And he was on Dawson's Creek and multiple movies, and he was a well-known actor. Apparently a fantastic, father and friend, and people love him. And so when he died, we always hear about celebrity deaths, and family wants privacy, and but there was a GoFundMe launched immediately. And the GoFundMe has now raised about $2.6 million. And so many people are going, wait, I'm a little confused. He's rich, and Steven Spielberg, I think, donated 25 grand, and you have everybody kind of jumping, to help the family, which I think is a beautiful, beautiful thing. But many people are questioning, why does the family of an actor, a celebrity, well-known celebrity, need $2.6 million. They asked for $1.5 million because I believe he had purchased a ranch. I think weeks before. So there's some controversy over it. I mean, as far as I'm concerned, he's passed. He has a family to take care of. But I understand why some people are like, wait a second, this money could go to people in need. What's the situation here? Why does a celebrity need money? Well, apparently the story is weeks before his death, he put a down payment on a mortgage for a ranch, a $4.7 million ranch that the family had been renting. Now, the down payment came from friends who wanted to convert the rental into a purchase because they knew what was coming down the pike, and they wanted to make sure that the family had a place to live. Now, a $4.7 million ranch, yeah, it does make you scratch your head a little bit. Yeah, it's a big family. They have a family of 6. But apparently celebrities had helped him put a down payment on this ranch. And so when he passed, and may he be in heaven and at peace, there's been a lot of controversy over, now he needs money to pay for this ranch, and the family needs money, the kids' education, etc. And when you look at the GoFundMe, it raised money overnight, really quickly. They only asked for $1.5 million. They've already raised $2.6 million. And there's now been a lot of critics going, wait a second here, $2.6 million could have gone to poor people. It could have gone to cancer research. It could have, and as far as I'm concerned, I hate to see a family go through any loss of their beloved father. I mean, it's not easy. He has 6 children, and many people who were stars, doesn't necessarily mean they're rich. They might get paid more for their acting jobs than we make in a lifetime, but that money oftentimes doesn't last. And it doesn't sound like it was the wife that said, I need money now that my husband died. It sounds like the friends of the family. This was something that was external, going, let's make sure this family has money so she doesn't have to worry about that because she has 6 kids. So I'm okay with that. But this brings the conversation of life insurance. Did he have life insurance? We see this in non-celebrity families all the time, where the loss of a loved one devastates them financially. My grandmother had gotten ill, and her children couldn't pay for the funeral, anything like that. So we did. And then months later, my dad died. Now, when you pay for a funeral, and this was in the early 2000s, that was at least for a very minimal one that honored her religious requests, it was at least 10 grand. Now you're looking at 25, 30 grand a funeral. I mean, it's just debilitating. And so then when my father died, I asked, you guys have any life insurance? No, nothing. Any money? No. So of course we, transferred the body to Las Vegas, paid for another funeral, and we bottomed out Our family, I mean, we had only $20,000 in the bank. And then now on top of that, we had to take care of my mom and my teenage brother. Because my father, when he died, they were poor, so no life insurance, nothing. And so we don't want to think about it. And one thing that I was really frustrated with my family is when I would talk to them about life insurance and talk to them about what are they going to do. They said, well, you'll handle it. No. Plan B? Do you have another plan? What about life insurance? No. Shh. Don't talk about life insurance. That's a jinx. If you talk about life insurance, one of us will die. They didn't believe in life insurance. Well, you have to, as a family, have the hard conversations. And I don't know much about the Vanderbeek's family financial issues. I mean, my guess is if he did have, colorectal cancer, that costs a lot of money. That, I understand that you need security when you're a celebrity and that, the money runs out. I get that if you don't have frequent acting jobs. And then when you're sick, I understand that celebrities are not always rich. I get that. But I think, this kind of highlights and reminds us that even celebrities can struggle financially. I mean, I wouldn't buy a $4.5 million ranch, but it sounds like the Friends wanted to change it from a renting situation to a home situation. And maybe the mom can't work. And this is so that the family can, be together and not, have to struggle. Who knows? But you just start to think about all the other families that are lower income, middle income. What do they do when somebody dies? And the average person doesn't have life insurance, or their life insurance terms out. Or what happened to us is we had a policy that we were paying every month early on the dot. And then they changed, I guess, the billing address, or they changed something. And by the time we got they claimed they notified us and they didn't, right? And now I'm middle age. So, and it was a great, great policy. And then they go, well, sorry, now you're over 30 days. We dropped you. I'm like, wait, what? No. I've been paying. Here's the money. They give it back. They say, sorry, we dropped you. Why? Well, because they insured me when I was young and healthy. Even though I'm still healthy, knock on wood, I'm older. And so life insurance can sometimes, be a scam for some. But it's so important to have something where, God forbid, something happens to you, your family is not going to be in trouble. And I've seen that time and time again. And in my family, no man lives past 62, 63 years old. So we have destitute families over and over and over again in my family because they've always been poor. They never had money put aside for retirement. Definitely wouldn't have, especially in this day and age. So, I hope the Vanderbeek family, gets through this time as easy as possible. I understand the need to make sure that the kids don't have to move and be traumatized. But then on the other end, $2.6 million, it's fantastic to see all the generosity. But it does kind of make you wonder, if celebrities need that kind of money, imagine, everybody else. 1-877-Doc-Dolly. Don't go away. Hi guys, Dr. Dahlia here. Addictions can sneak up on us and come in many forms, whether it's drugs, alcohol, sex, video games, porn, or something less obvious such as food, internet, or shopping. Addiction can seem innocent at first and then evolve into an insurmountable evil. In our book, Addiction Basics, Caitlin Kalikas and I dive into the common addictions and provide tips for identifying and preventing these before they sneak in and take over our lives. Addiction Basics can be found on Amazon or my website, drdahlia.com. Check it out.
Increase fuel economy up to 7.9% with Hot Shot Secret Gasoline Extreme, the solution to maximize your engine's performance and fuel economy. Whether you're driving a sports car or a daily commuter, Gasoline Extreme is specially formulated with PEA to deep clean. Don't settle for an average driving experience. Upgrade to Hot Shot Secret Gasoline Extreme and go further on each tank. Order now on Amazon or HotShotSecret.com. Hot Shot Secret, powered by science.